We are continuing with the axial skeleton. We're done with the skull, but we move into the vertebral column, which consists of 5 regions: cervical, thoracic, lumbar, sacrum, and coccyx. We're going to review the information here in the image on the next slide. So here it is. Let's begin with the most superior region of the vertebral column, and those are cervical vertebrae. There are 7, and we name them C1, C for cervical, right up top, all the way down to C7 at the base of the neck. In the chest area, we have thoracic vertebrae, and we name them T1, T for thoracic, all the way down to T12 at the base of the back of the chest. Moving inferior, we come to the lumbar region. There are 5 lumbar vertebrae, and we name them L1, L for lumbar, all the way down to L5. Next, we have the sacrum, and right at the inferior tip of the sacrum, there is a tailbone, which we call coccyx. I'm going to explain these normal curvatures on an image. So, the thoracic spine and the sacrum are convex when you're looking at it from the posterior view. Convex meaning the curve kind of comes toward you. Where the lumbar spine and the cervical, although it's not really showing much of a curve here, the cervical vertebrae and lumbar vertebrae are concave from the posterior end. From the anterior would be the opposite, but from the posterior side it's concave, like you're going into a cave, kind of think of it that way. And here's that information here. Curves could be abnormal in the spine, and here's 3 types of abnormal curves: scoliosis, kyphosis, and lordosis, which we'll see on an image. From the posterior view, the spine should be relatively straight up and down. However, we can see there's a sideways curvature to the spine right here. That is what a scoliosis is. It would be a sideways or lateral curvature from the posterior view. From a lateral view, well, we have normal curves, but if the thoracic curve is exaggerated, we know it is convex posteriorly, but if it's more convex than it should be, like right here, we call that a kyphosis. Kyphosis, otherwise known as a hunchback or humpback. We do have a normal lumbar curvature. It's concave posteriorly. If that lumbar curvature is exaggerated, like right here, which happens often with pregnancy because of the extra weight in the abdominal pelvic cavity, pulling it forward, which, by the way, would go away after pregnancy, that would be a lordosis. Lordosis is an exaggerated lumbar curvature, otherwise known as swayback. Between each vertebrae, we have intervertebral discs. Inter means in between. So these are discs in between vertebrae. So here's an intervertebral disc. They're made up of fibrocartilage, which we learned from a previous chapter, and they're little shock absorbers. They're to absorb our weight. Now these intervertebral discs, if we look at them from this view, contain 2 regions. The center region, which is the nucleus pulposus, is very gel-like or gelatin-like, and then it's surrounded by these tough fibers that we call annular fibers, or annulus fibrosus, to be fancy. This is a normal disc. Think of this like a jelly donut with soft interior and tougher exterior. Well, that jelly could squeeze out of the donut, and that would be a bulging disc. If you ever heard that term before, that's when the nucleus pulposus breaks through these annular fibers and then starts affecting nerves around the spinal cord.